Dr. C. Welcome to my work area. Okay, our last dissection. The kidneys are retroperitoneal. They lie on the dorsal body wall. And the adrenal gland would be near the cephalic end of the kidney. The ureters are a muscular tube beginning at the hilum of the kidney. The urinary bladder, when distended, extends into the pubic region. The urethra is a fibromuscular tube where urine leaves the body. The anorenal pelvis is a funnel-shaped tube inside, internal kidney. The middle medulla borders the renal sinus, and the outer cortex is the outer part surrounding the medulla. The esophagus is posterior to the trachea, and it has three parts: a cervical, abdominal, and thoracic. It's kind of hard to see. The liver is inferior to the diaphragm, and it is responsible for the production of bile. And on its right lateral lobe would be the gallbladder, which stores bile. The stomach has four parts: the cardia, fundus, body, and pyloric parts. The duodenum or duodenum is between the pylorus of the stomach and the jejunum, and that's in the small intestine. So the second part of the small intestine would be the jejunum, and the ileum would be the third part of the small intestine. The spleen is in the left hypochondriac region, and it helps with erythrocyte breakdown. And the large intestine is in all abdominal quadrants, and the pancreas is also posterior to the stomach, and it aids in digestion. Okay, so I have a female, and her labia would be in the urogenital triangle, and it's paired elevations of skin. The vagina is also in the urogenital triangle, and it's in the vestibule between the urethral orifice and the anus. The cervix is in the uterus, and the uterine body contacts the anterior bladder and the posterior intestine. The fallopian tubes are between the lateral aspect of the body of uterus and the ovary. And the ovaries, which are very hard to see, are near the distal end of the uterine tube. Thank you so much, Dr. C. I appreciate everything this semester.